and a warm welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we are so excited about our first Tongue Tie Conference 2024. We had our Tongue Tie Symposiums, of course, in the past, but this year we are launching our brand new conference. And with me here is one of our speakers, Dr. Shifa Shamsudeen. Welcome, Dr. Shifa.
Hello, hi, thanks for the welcome.
It's wonderful to have you here. You have a great presentation planned for us with plenty of videos and wonderful images and great information. And the presentation is titled The Role of Breastfeeding and Frenotomy in the Prevention of Pediatric Obstructive Sleep Apnea. And before we jump into the topic, I would like to learn a little bit about you. You are a pediatric dentist, so talk a bit about your work.
Hi, I'm Dr. Shifa. I'm a preventive pediatric dentist. I've been a pediatric dentist for almost a couple of decades now. So my interest in prevention started somewhere in the late 2000s, maybe early 2010. And then the first form of education was to learn about myofunctional therapy. And then as I learn about myofunctional therapy, there's a huge role that we learned about the role of tongue in terms of orofacial or craniofacial growth and teeth alignment. And then later we learn about cavities, and just like how a puzzle fit in over the last 2 decades, we in prevention practice, we have evolved to learn that the first step of prevention is promoting exclusive, extended, non-compensated breastfeeding. And this has been a wonderful journey learning about how being a pediatric dentist now, the predominant base of a practice is to optimize breastfeeding. Even before the teeth erupts, we have families walk in to help them optimize the outcome of breastfeeding. And over the last couple of decades, with our database and with our patients, we've seen that we with just optimizing breastfeeding, we were able to cut down the risk factors for them to develop pediatric obstructive sleep apnea. And as I learned from my teachers back in Tufts and Stanford, I've always heard and learned the fact that prevention of obstructive sleep apnea is only possible when they are young. Once they are into their early adulthood, or as they're growing, there's only symptomatic treatment. So this led to an intense passion to dive in about how to holistically help children get the benefit of prevention in the development of sleep-related breathing disorders.
I love what you just said. And I think there is some really brand new information there that many people are not aware of, that what you just mentioned, you have to be, the patients have to be young to really tackle the issue. Otherwise, there is only treating the symptoms rather than the development, which is fascinating. And one thing I find fascinating, we all know how the beautiful benefits and all the important benefits of breastfeeding and breast milk. But one thing I would like you to talk just briefly about how exclusive breastfeeding can contribute to the development of the wider airway and jaws in an infant, because, I don't think many people, especially parents, are aware of that. And how, as healthcare providers, can we educate them on that?
So as we all know that the world is shifting to holistic care in all aspects of well-being, not just head and neck, overall. So we know earlier, a couple of decades before, or even much before, diabetes, when you go into diabetes office, it's usually medications, but you walk in now, it's completely different. It's about counseling the diet, counseling their lifestyle. Similarly, dentistry is gradually shifting into a lifestyle. So most of the dental diseases, including the jaw growth, the teeth alignment, or cavities, they're lifestyle induced, right? And as with the whole body, where exercise and your diet plays a major role, so is with your head and neck, your craniofacial complex, your maxillofacial mandibular complex also needs a good diet and exercise. And the first ever exercise that a child can get is feeding from the breast, right? So feeding from the breast is almost like walking up the stairs. Than alternate form of feeding, it's like using an escalator, if you have to just put it as simple as that. So the benefit of breastfeeding, extended exclusive breastfeeding, goes a long way just with the nutrition. And what we've seen over the years is how this exercise contributes to the development of jaw growth. And that is what we're going to exactly talk in depth during the presentation, right? How these optimization plays a major role in the development of craniofacial mandibular complex, maxillomandibular complex. And to just put it in one word, we are going to optimize the nature-made exercise, that's breastfeeding, and how that can help in the development.
Fantastic. I love how you just explained this and it becomes so clear. Thank you so much for that. Now, you mentioned the connection between tongue tie and the risk of pediatric obstructive sleep apnea. Can you just briefly, I know you will have the full presentation talking about that, but just a little bit of what we can look forward to in the presentation and talk about the connection there.
So what we have surprisingly figured out is one of the biggest myth is breathing starts with nose, is what we've always thought about. But what we have figured out in the last couple of decades is breathing starts with mouth. Your tongue will have to be in a certain resting position for the nasal breathings to be stimulated, right? So the breathing starts with the position of the tongue. So for a child to get the full benefit of breathing, it should be nasal, and nasal breathing is one of the key prevention factor of any form of sleep-related breathing disorder, right? So, but when a tongue is dysfunctional, either it's a physical tie, or if there is a muscular dysfunction, or if there's a birth-related trauma where the tongue is not able to function to its optimal potential to initiate the nasal breathing, there's a huge risk factor in the development of obstructive sleep apnea. It's not just you have a tie, it's not directly proportional, but you develop the risk factors to develop the area of obstructive sleep apnea. So what we would beautifully learn during the presentation is how the tongue position plays a major role in prevention of sleep-related breathing disorders.
Fantastic. I can't wait for this. There's so much to discover and so much to learn. I have a question for you because I know you are a research nerd. You love research, right? Evidence-based information. You're diving deep into that also in the presentation. But when it comes to research, what advancements would you like to see in the field? Where do you think we need more research? What do we still need to take a deeper look in? And if you had a magic wand you could wave, what areas would you like to do more research in?
So we would need long-term studies looking at the role of breastfeeding in the holistic development of the child and not just nutrition. We have amazing studies talking about the content of the breast milk and how the content and the nature of the milk as such, but the process is something that's not researched much. Just going back to the very simple, humble fact is that if breastfeeding is optimized, it would be a nature-driven, holistic way. There's no industry that comes in between. So we would need more philanthropists. We would need more people who is interested in holistic well-being to, help practitioners in kind of encouraging them and funding them to do these long-term, multi-center global research, wherein one of my biggest dream would be, when a paper gets published saying that ultimately the preventive factor in dentistry, is just to promote exclusive, extended, non-compensated breastfeeding. So we would need more like-minded people to come forward to do multi-center studies, and we would want to see how this works in different ethnicity, different social backgrounds, and we would want to follow these children. And that's the best, I think, as healthcare practitioners, be it dentists, be it doctors, be it IBCLC, if we there's something that we can give back, this one evidence-based statement, if we can give back to the future generation, it's going to help them overcome a lot of lifestyle-induced new age diseases.
Beautifully said. Thank you so much. And that's why it is so important to bring forward, experts like you who educate and talk at these events and reach more and more healthcare providers, so they can also, learn more and also come forward and spread the knowledge there. Now, before I let you go, Dr. Shifa, give me just a couple of last wise words from you, what you hope our viewers will take away from your presentation.
So to my understanding, I think the audience has a lot of IBCLCs and a lot of speech language pathologists. What you would all be consider that you have a time machine. You have these children for a very short period with all of you, maybe few weeks, few months, or maybe till they start solids. But imagine you're given a time machine when you have a baby, and I take you back in time. I take you on a time machine to see how the baby does when the baby is 5 years old or 8 year old or a 10 or as a teenager. If the breastfeeding is optimized, how would the growth be? And if the breastfeeding is not optimized, what are the chances and risk factors in future? So on a very funny note, you are going to get into a time machine to see, to foresee, be able to foresee the future of all the infants that you would be touching from now on. After the presentation, you wouldn't be looking at the children just in terms of nutrition or weight gain. You would be looking much more deeper into their craniofacial growth or their overall holistic well-being. You will also be looking at their breathing, their sleep, and a lot more. I mean, it's very difficult after this presentation to unsee and just see a child from a nutrition perspective.
Oh, wonderful. I can't wait to step into that time machine with you, Dr. Shifa. Thank you so very much for being here with me today. And here at Gold, we're looking forward to your presentation. Thank you so very much.
Thank you so much. Looking forward.
And now I have some information for our viewers. This presentation, titled "The Role of Breastfeeding and Frenotomy in the Prevention of Pediatric Obstructive Sleep Apnea," is part of our Gold Tongue Tie Conference of 2024. If you would like to find out more about this presentation and all the other presentations and our open access keynote presentations, we would like to invite you to go to goldtonguetie.com for more information. And thank you everyone for watching, and I hope to see everyone at the conference. Bye-bye, everyone.